We have the doctors here with us, sort of a round table. We're focusing on men's health tonight, and we're now taking a look at some of the bad habits before we get to the solutions, things that you can do to help yourself. Dr. Ali, you had a list of bad habits. Let's go over that with men on the average between 40 to 55 years old that we have and we tend to do.
Sure, and I just want to emphasize again, smoking being the most common and most bad habit that folks have. And I urge everyone that's listening today, there's no better day to stop smoking than today. The other thing I want to talk about bad habit-wise is lack of activity. The American Heart Association recommends about 30 to 45 minutes of physical activity, i.e. walking, jogging, some sort of cardiac activity per day, and at least 5 days out of the week. Heavy alcohol use is also another bad habit.
Oh, Lord, Father, save me. Go ahead.
And that also can predispose you to cardiomyopathies and issues that can affect your heart. And the last being folks, especially men that don't want to see doctors. They have issues, whether it be any medical problems, and they don't feel that they need to go see a doctor.
It's just terrifying, though.
It really is.
From the perspective of just a regular guy like myself, thinking about going to the doctor. If you go, then you think they're going to find something else, and then I'm going to get 2 to 3 weeks to live.
Right. Well,
that's not reality,
that's not
but
reality.
that's my fear, and that's
Correct.
a fear for a lot of people.
And that's the fear that we need to kind of work on and correct, because we are able to now, with advances in technology, pick up lots of these medical diagnoses that we can pick up earlier, treat, and we can help save someone and give them a better lifestyle for the future as well.
Dr. Rustveld, from a dietary standpoint, what can we do better in order to extend our lives, improve our lives?
I think when we're talking about men, men tend to work very long hours, and they tend not to eat, and they tend to wait. And so when they come home, they end up eating way too much food, and the caloric consumption is excessive at that time. And then they go to bed, and they may have acid reflux, but more importantly, over an extended period of time, that can lead to diabetes, which is one of the risk factors that we mentioned earlier, but also cardiovascular disease. So it's important to plan the night before. You have breakfast, lunch, and dinner, eat a balanced meal, and watch your portions.
Obviously, it's easy to say just start eating healthy. Can you do it step by step, inch by inch, as far as learning the process of getting away from the fried foods, from the fatty foods, from the high sodium, and going to the healthy foods? Absolutely.
We always recommend small changes. There's nothing wrong with eating fried chicken as long as you're not eating it every day. But as long as you're also eating balance, so meaning you can use the plate as a guide. Half the plate can be vegetables, a quarter can be protein, preferably grilled, broiled, baked proteins, and then a quarter of the plate should be starches. If you're still hungry, you can eat as much vegetables as you want.
Dr. Ali, let's talk about exercising. How important is that in improving your life, making your life healthier?
Yeah, it's very important. One of the most important things that we can talk about tonight is folks getting out and being more active. After they watched Isaiah Factor, or even before they watched Isaiah Factor, to get out and do some sort of activity, either walking, jogging, especially after they've had a meal or they're about to do some sort of activity that may involve heavy consumption of food. So taking appropriate measures beforehand to watch their diet and to exercise properly.
As we close, I'm going to give you about 30 seconds each. What would you stress to people in order to get them off their sofas and stop all of the bad eating and to be there for themselves and their families?
Yeah. Statistics, I think 1 in 4 Americans die that are middle-aged folks are men, and they die from cardiac risk factors, and those are folks that have not taken care of themselves. They have neglected to visit doctors. They've neglected to look at some of the recommendations that we come out with. They've neglected to stop tobacco abuse and tobacco use. They've neglected to stop heavy alcohol consumption. So all of these, it takes a toll on your body, and as we age, that toll comes to you, and it comes in a fashion where it potentially kills you.
Dr. Rustveld?
I think start basically realizing that it's never too late to make changes, and start with small changes and then make them part of your daily routine.
All right, Dr. Rustveld, Dr. Ali, thank you guys for coming on The Factor Uncensored.